So Berberine is a hot topic online, it seems, at the moment because it helps people to lose weight. Today I'm going to talk about Berberine, but I'm going to focus more on some of its other health benefits, especially with regards to gut health and IBS diarrhea, glucose metabolism and lipid metabolism, because there are just hundreds of studies that show that it helps with all of these things. At the end of this video, I'm also going to share what I'm using to help to heal my gut up and hopefully lose weight faster using both Berberine and a few other natural products. Now, first I want to say that I am not a doctor and this is not medical advice, so please do not take it as such. I'm just looking at studies and trying to work out stuff for myself and sharing with anybody who's interested, because some people, especially when they go into carnivore, a lot of people have great results straight away, but some of us just have ongoing issues that probably most of the time it is down to gut health. So if you go back and look at my recent videos, you'll see that I've just had a go at the Lion diet, which is just red meat, salt and water. My plan was to do that for 30 days. I only lasted 17 days because the diarrhea came back with a vengeance and I just could not handle any more than 17 days worth of that. So now I'm looking at other ways to heal my gut, and I was hoping that I might be able to do that on the Lion diet, but I think I have some things to sort out first. And while I was on the Lion diet, I came across information about Berberine and its the research for IBS diarrhea. Now I started on Berberine while I was eating a Lion diet, but because the diarrhea was so bad, I wasn't sure what was actually going on, and so I only did 5 days on Berberine and then stopped. But I am now starting again now that I've got things settled back down again. So, and I thought I'll let everything settle down and then start again. And so that's why I've been digging into this research, having a look at what they have found about Berberine, and it's pretty intriguing and pretty exciting. So Berberine has been used in China for between 2,500 and 3,000 years, and in Ayurvedic medicine in India. And so there's a lot of research that's been done in China, but researchers generally are really excited about this product. There are over 700 articles being published every year on the effects of Berberine. So what is it? Berberine actually occurs as an active constituent in the root, rhizome and stem bark of many therapeutically important plants, including golden seal. I'm not going to say the Latin name. So golden seal, Oregon grape, barberry and coptis or golden thread. And there's also an Indian species which is commonly known as tree turmeric. Now I'm going to share my screen so we can have a look at some of these studies. I've just kind of picked a handful. 2 or 3 of them are meta-analysis, so that's where they pull a whole bunch of studies together and collate all the data from those. So I'm going to have a look at them with regard to the different areas that I'm interested in. So mainly the IBS diarrhea, the glucose metabolism and the lipid metabolism. So let's have a look at these. Okay, all right. So this first study is a randomized clinical trial of Berberine hydrochloride in patients with diarrhea predominant irritable bowel syndrome. So in this study, they took 196 patients with IBS diarrhea, and 132 patients were randomized to receive 400 milligrams of Berberine delivered twice a day or a placebo for 8 weeks. Now that's a kind of a fairly standard dose. Around about 1,000 milligrams seems to be pretty standard. Some studies will use way more. They'll use about 3,000, which is probably way too much. But yeah, this is 800 milligrams a day, and between that and sort of 1,000 seems to be about average. So the effects of Berberine hydrochloride on IBS diarrhea, defined by a reduction of diarrhea frequency, abdominal pain frequency, the urgent need for defecation, were significantly more pronounced in the Berberine group than the placebo group in the 8 weeks of treatment. Also, IBS symptom score, depression score, anxiety score were all improved, and so these it says that these effectively improved patients' quality of life, which of course they would do. If you've had any of those problems, you know that they really do affect your life. So I'm just going to go and find my other studies. So this one here. All right, so this study here, the effect of berberine on irritable bowel syndrome, a symptom-based review. Now, they're talking here just about the different symptoms of IBS and the step-by-step therapy for IBS symptoms, which includes in here some natural products such as peppermint oil, activated charcoal, a low-carb diet, fennel and chamomile, a gluten-free diet, and probiotics. So all of those things, I've highlighted those because they're all things that I've kind of done over the years and still use. I still use peppermint oil and other essential oil blends and activated charcoal, and I've eaten a gluten-free diet for many years, and I'm now eating a low-carb diet on the carnivore diet. So what they did here was, it says in the research strategy of this review, the electronic databases of PubMed, Google Scholar, Medline, and Web of Science were used in all publications until August 2021 was searched without language restrictions. So first, a general screening was performed with the keyword berberine and irritable bowel syndrome, and then each symptom was searched individually using the following keywords: berberine and abdominal pain, berberine and diarrhea, berberine and visceral hypersensitivity, berberine and microbiota, berberine and anti-inflammatory, and berberine and anti-nociceptive, berberine and motility. So what they're doing there is they're basically pulling all the studies that they can find up until August 2021 that have those that are based around those keywords. So if we come down here, this is the effects of berberine on IBS symptoms. So the diarrhea part of this, it says berberine-based nutraceuticals twice a day, 250 milligrams for 90 days, reduced diarrhea by 50 to 70% after 30 days and by 70 to 80% after 90 days in 39 patients with functional diarrhea or diarrhea-predominant irritable bowel syndrome. Reduced smooth muscle contraction and intestinal motility and delayed intestinal transit time, reduced bowel motility, reduced ileum mucosa inflammation. So that was a pretty good result with just 250 milligrams twice a day. So that's a 500 milligram a day dose. And they've also found here that it produced a dose-dependent increase in trans-epithelial electrical resistance in CACO2, I think that's how you pronounce that, 2 cells. So what that's talking about is the tight junctions, the leaky gut, intestinal permeability. So if you've ever seen diagrams of this inside your small intestine, the cells are supposed to be tight like that, but what happens in leaky gut is that they spread apart and they end up, those tight junctions relax and they end up with gaps where foods and other things can get through into the bloodstream. So that's basically what leaky gut is, very simplified version. And so what they found in these studies is that the berberine helped to tighten those junctions back up again, which is exactly what we're looking for if we have IBS diarrhea or leaky gut or both. The IBS diarrhea and leaky gut are pretty much always tied together. You can have leaky gut without having diarrhea, IBS diarrhea, but when you have IBS diarrhea, you've pretty much always got leaky gut. So from my understanding anyway. So the only adverse events that were reported basically was mild to moderate constipation. That was the most frequently recorded side effect from the berberine. So here it says with the diarrhea, in addition to its antimicrobial effect, studies show that it plays a role in ion transport, especially in secretory diarrhea. Berberine strengthens tight junctions in the CACO2 cell line, reducing intestinal epithelial permeability. So that's what we were just talking about before. 39 patients with functional diarrhea or IBS diarrhea that used a berberine-based nutraceutical twice a day, 250 milligrams for 90 days were evaluated. It was reported that after 30 days of berberine use, diarrhea was reduced by 50 to 70%, and this rate of decrease reached 70 to 80% at the end of 90 days. So that's a really good result in 3 months. Okay, so it says that berberine can positively affect colitis, and I would I'd say that any kind of bowel issue, berberine is probably going to positively affect. But that's not medical advice, remember that. So in a mouse study, mice with IBS and intestinal inflammation were orally administered berberine, which was shown to reduce intestinal mucosal inflammation. So it reduces inflammation in the bowel and in the digestive tract. And constipation was the most serious side effect. So the microbiota seems to be the main way that this stuff actually works. So studies have shown that one of the most important effects of berberine is its ability to alter gut microbiota composition. Berberine can induce cell death in harmful intestinal bacteria while increasing the composition of beneficial bacteria. In addition, in another study investigating the effects of the IBS diarrhea gut microbiome on the liver, it was emphasized that IBS diarrhea was not only a functional bowel disease, but could also cause inflammation of the liver. So existing studies provide evidence for the use of berberine as a drug in IBS diarrhea and show that it can be beneficial when used in selected patients. So that was the conclusion that they've come to from these studies. All right, so I'm going to move on to the next one. So berberine, this is a meta-analysis as well, which shows a whole bunch of different effects. So I'm just going to quickly run through those. Berberine influences multiple diseases by modifying the gut microbiota. So that gut microbiota is responsible or takes a part in our health or lack of in many, many ways. So it says 2 authors searched the literature published in 2022 through Medline, PubMed, Embase. Using berberine and gut microbiota as keywords, they included the literature meeting the following criteria. Patients and animal models of gut microbiota were studied. Studies were clinical trials or animal experiments of berberine intervention, and the primary endpoints were changes in organ function, metabolic status, and inflammatory response. So they started off with a couple of hundred and they excluded a whole bunch and they ended up with 35 good quality studies. All right, so if we go down here, you'll see that they've had a look at the effect of berberine for different diseases. So this first part is related to glycolipid metabolism. So that's blood sugars and lipids. And so, of course, the first disease that they're talking about here is diabetes. In a rat model of diabetes, intragastric administration of berberine at a dosage of 200 milligrams per kilo suppressed blood glucose levels, improved glucose tolerance, and serum lipid parameters after 6 weeks. The relative abundance of bacteroides increased in the BBR, which is berberine group, while the relative abundance of these other two decreased, and probiotic lactobacilli are significantly upregulated in the berberine group and have a negative correlation with the risk of type 2 diabetes. So in other words, the way that it balanced the gut microbiome out helps to reduce the incidence of diabetes and manage blood glucose. And that's what I found even in the 5 days that I was taking the berberine. I was taking a full dose. I was taking 1,000 milligrams. I found that my blood glucose after eating was way lower than it has been. So normally after I'd had a meal, especially if I was only eating 1 meal a day and eating a lot of meat at dinner, my blood glucose an hour or even 2 or 3 hours later would be 5.5 at the lowest, and yet a few days into taking the berberine, maybe 3 or 4 days, I took my blood glucose an hour after eating probably about 800 grams of meat, and it was 4.7. So that's never, ever happened before. So I was quite impressed. So through this meta-analysis, they're talking about the effects that it has on hyperlipidemia, which causes high cholesterol. And so it shows that berberine reduces blood lipids after 12 weeks of oral treatment, half a gram, so that's 500 milligrams twice daily, in patients with hyperlipidemia. However, there were significant individual differences. Berberine lowers cholesterol by regulating the gut microbiota. And I'm going to link to these studies underneath the video. So if you want to go and have a look at these, you can. So gastrointestinal disease, so irritable bowel syndrome, gastrointestinal tumours, it talks about that. So that's colorectal cancers, so bowel cancer and that sort of thing. Liver disease as well. So it says berberine has potential value in the treatment of liver diseases by reshaping the structure of the gut microbiota, especially by modulating the abundance of short-chain fatty acids producing bacteria, for example. And then it also can help with mental disorders because it's affecting the gut microbiota. Once again, your gut and brain is intricately connected. And so if the gut isn't happy, the brain tends to not be happy as well. And immune disease and other diseases. This suggests that berberine may treat periodontal bone loss caused by estrogen deficiency by regulating the gut microbiota. So yeah, osteoporosis is one of the diseases that they're talking about in there. So yeah, conclusion, it says this paper mainly describes the effects of different berberine doses on various diseases by regulating gut microbiota. The multi-pharmacological effect of berberine can be explained, at least in part, by its regulatory role in the gut microbiota. The evidences presented in this paper shows that the different roles of berberine in diseases are related to the diversity of gut microbiota. In diabetes, berberine plays a hypoglycemic role, mainly through short-chain fatty acid producing bacteria and bacteria related to bile acid metabolism. In patients with hyperlipidemia, berberine alters host lipid and cholesterol levels by regulating lipid synthesis related to microbiota. And what else? BBR reduces the production of TMA, TMAO, inflammatory factors, and chemokines, I think that's probably pronounced, by remodeling gut microbiota, thus playing an anti-AS role. I'm trying to think what an AS role is. I'm not sure. I can't remember. So in intestinal diseases, berberine mainly maintains the intestinal mucosal barrier, regulates immune homeostasis, reduces visceral hypersensitivity and anti-inflammatory effects by altering lactic acid producing bacteria, carbohydrate producing bacteria, and short-chain fatty acid producing bacteria. In the liver, berberine mainly alleviates liver damage by regulating short-chain fatty acid producing bacteria and FXR related bacteria. In mental disorders, berberine plays an anti-inflammatory and anxiety relieving role by regulating microbiota-related metabolites. So you can see there's a whole bunch of stuff in there that just indicates that this substance is really worth looking at for some of these health issues. Now this one here, so it just talks about berberine being used for 3,000 years. It's got a long history of use in Ayurvedic and Chinese medicine, as a potent antibacterial, anti-cancer, anti-diabetic, anti-obesity, neuroprotective, anti-diarrheal, anti-inflammatory, antidepressant, and hepoprotective activity, which of course is your liver. And I think in this one, I've been reading these all morning and just picking bits out of them, and I thought I'll just share them. So the anti-obesity effect of berberine, I thought this was interesting. It says it has an effect in reducing fibrosis of adipose tissue. Now, when I read that, I immediately thought about myself having all these lumpy bits in my belly, and I've talked about them in a couple of my past videos. So when I went to the doctor years ago when I was diagnosed with Graves' disease, and one of the reasons I went was because I had this lump that had appeared in my belly, and she said it's a lipoma. So it's about, at the moment, like varies from, I'm trying to get the camera right, varies from about that size down to that size. It seems to get bigger and smaller, maybe depending on how much fluid is in it I'm picking. But underneath that, over the years since, I've got this feeling, the stuff in there that feels like brain, like it's hard, lumpy, like a brainy texture, and it was in both sides of my belly, and it was painful to touch. Now that's actually reducing. Since I've been on the carnivore diet, it's pretty much all gone from the right hand side, and the left-hand side where the lipoma, the original lipoma is. It's still there, but there's less of it and it's less sore. It seems to be shrinking, so that's pretty cool. So when I saw that fibrosis of adipose tissue, because I'd read that berberine can help with fibrosis as well, I think. And even though this is the first that I've come across it in the studies, I must have read something the other day and kind of figured that might be something that had been going on with me with some of my tendons and that in the past where I've had problems. But this is the first that I've come across the fibrosis in fat. So that kind of makes sense. So it says berberine reduces the levels of hepatic and plasma triglycerides and cholesterol as well. So it's quite a big deal when it comes to fatty acid metabolism. So it has anti-inflammatory effects, antidepressant activity, which is all stuff we've looked at in those other studies. Neuroprotective effects. Now, that's not something that those other studies haven't talked about, I don't think, and helps to improve learning and memory, reduces cholesterol and the risk of Alzheimer's. So this is all stuff that's coming out of these studies and not stuff that I'm just pulling out of thin air, okay? So if you've been following me for a little while, you possibly know that I actually really like making designs for t-shirts and hoodies and other products specifically for carnivores. So if you are after a gift for yourself or another carnivore, head over to my store and have a look at my designs and see if there's something there that takes your eye. Now let's get back to these studies. If we have a look at this study here, so the results of this 37 studies involving 3,048 patients were included in this meta-analysis. So the conclusion, berberine has a glucose-lowering effect, which is related to the baseline FPG and HbA1c levels of patients. Treatment with berberine may be safe since it does not increase the incidence of total adverse events and the risk of hypoglycemia. So yeah, as I said, that means that it's not causing diabetics to have big low sugar crashes. But it did have benefits. And then this last study, so this last one is out of Nature, and it's titled Berberine Treats Atherosclerosis via a vitamin-like effect, down-regulating choline TMA-TMO production pathway in the gut microbiota. So this study is showing that berberine reduces plaque in the arteries, which is pretty interesting. So the study showed that berberine reduced plaque by 3.2% in over 16 weeks. The control group, so they had a control group that were on pharmaceutical interventions, so pharmaceutical medications for that sort of thing. And the control group had an increase of 1.9% in arterial plaque over the same period. So the people who are doing this study, they say that since 2004, our group, as well as others, have identified berberine to be a safe and effective medicine for hyperlipidemia and type 2 diabetes in clinic, with mechanisms and mode of action very different from the known drugs. The reported mechanisms include the upregulation of low-density lipoprotein receptor and insulin receptor gene expression, activation of AMPK, inhibition of pro-protein convertase, subtilisin, kexin, type 9 expression, and others. Although recent studies in animals have shown that berberine also exhibited inhibitory effect on plaque development in atherosclerosis. Little is known about the mechanism. The oral bioavailability of berberine is probably about 1%, suggesting the possible role of the gut microbiota in berberine's therapeutic effect against atherosclerosis. I think that's probably right because everything else seems to be pointing to the effect that it has on the gut microbiota and the benefits that this substance has. So in this study, I was going to go down to page 8. So they used a 500 milligram dose twice a day. So as I said, about 1,000 milligrams a day seems to be a really common dose. But some of the studies use less than that. So I guess it just depends. You might not need the 1,000 milligrams depending on what's going on. But this diagram here shows the plaque in this person's arteries. I think this is a carotid artery. I'm not really sure. I've got a feeling that it is. This is before and this is after, and it's showing that these plaques actually reduced in size by 3.2% over 16 weeks. And so it says Berberine reduced the plaque size in patients with atherosclerosis. 4 months of Berberine therapy are shown, including the common carotid artery. The average plaque score in patients was decreased by 3.2% after oral Berberine in a 0.5 gram dose twice a day for 4 months. The score value was slightly increased by 1.9% after treatment with conventional drug combination, including rosuvastatin, aspirin, as well as a couple of other drugs. So these are normal drugs that they would give people for heart disease. So the calcification actually increased on those, which is kind of interesting. So Berberine reduces the amount of TMAO in the blood, and TMAO is associated with cardiovascular disease. So in the discussion here, it says, in the present study, we show that Berberine could decrease the levels of TMA and TMAO in feces and blood, improved blood lipid profiles, and significantly increased IMT value in the high fructose diet-fed arteriosclerosis hamsters. Further investigation revealed that Berberine decreased the transformation either from choline to TMA or from TMA to TMO in the intestinal bacteria, thus reduced blood TMAO. Mechanism study showed that Berberine reduced TMAO production through inhibiting the activity of enzyme CUT-C and FMO on the gut microbiota. So these studies were done on both animals and humans. Okay, so these are just not just animal studies. In the conclusion, in summary, oral Berberine reduced TMAO production in the gut microbiota, followed by a decrease of TMAO in blood. This effect might be an important part of its action against plaque in atherosclerosis. The TMAO lowering effect by Berberine in gut flora attributes to its inhibitory activity on enzyme CUT-C and FMO of bacteria. The mode of action suggests a vitamin-like mechanism of Berberine on intestinal bacteria. Berberine caused TMAO reduction was seen in the atherosclerosis patients in whom Berberine's therapeutic effect against plaque was observed. Thus, it was justified to develop Berberine as a medicine for the treatment of atherosclerosis. So that's all of the study. So that's all pretty interesting, isn't it? From looking at all of these studies, you can kind of see that the microbiome is key. And as I said, I really suspect that that's a big part of my problem. And I've seen some things that suggest that maybe some people are missing some important microbiome, but hopefully not. And hopefully I can get things to sort out by using Berberine and some other products. So I've been having a look at the way that some of the stuff is treated by natural health practitioners and various doctors that work with these sorts of gut issues. And so my plan moving forward is to use Berberine. I've started already. I started yesterday just on one capsule a day. So that's 333 milligrams with the ones that I've got. And I thought I'll take one initially for a few days or maybe a week. And then I'll up it to 2. And then I might try going back up to 3 again. Just when I took it before, my belly was so grumbly. I keep moving on my stool. My belly was so grumbly and I just wasn't really sure what was going on or whether that was causing the diarrhea or whatever. So that was why I stopped it until I got off the line diet and got things settled down. Things are really settled again now. It only took a couple of days, even the next day after having blueberries. It just all settled. And so I've actually saw something today that a guy who was talking about, oxalates, but he was talking about how fiber, the the fermenting of fibre in your bowel reduces the amount of endogenous oxalate that your body's making in your liver. So I thought that was kind of interesting, and it's something that I'm going to have a look into more as well, because I've been putting a lot of this down to oxalate dumping and the flora in my gut's ability to manage that, I guess, is part of the equation, maybe. So yeah, that's something that's kind of interesting. But at this point going forward, I'm doing the berberine. I'm taking oregano oil, however you want to pronounce that. So I've got lots of that. I use doTERRA oils, and so I've mixed a blend of oregano oil and some fractionated coconut oil, and made that half and half, and I'm just having 5 drops of that mixture in a capsule twice a day is what I'm doing at the moment. So I thought I might do that for about 10 days and then have a little bit of a break, maybe a week off, and then go back to it again while I'm also taking the berberine. Now I'm also taking L-glutamine in the form of colostrum. So colostrum has L-glutamine in it, and so does cow's blood, and I have a cow's blood supplement there, so I thought I might take that as well. It has dried blood and liver in it, so I thought I might take that. And I have a product called Gut Health, which I've talked about before on here, which is the highest amount of anything in there is the L-glutamine. It also has slippery almond, marshmallow, and a few other bits and pieces in there. It's a really good product, and that was what it was taking that kind of really got me on the path to the whole diarrhea thing settling down. So I will continue to take that, and I'm also taking quercetin at the moment because I noticed, not last night, not before, I ended up with that histamine rash a little bit on my arm after I'd eaten dinner, and I didn't sleep last night. That night I had about 3 hours sleep, so my histamine levels were obviously up, and so I thought I'll take some quercetin because I've got some of that here. And I'm also again drinking dandelion tea and stinging nettle tea to try to keep those levels down until hopefully I can get something happening with my gut flora. So that's kind of where I'm at, and that's some of the studies and research on berberine. If you've used berberine, if you've got any questions or comments, please put them below and I'll get to them as soon as I can. If you've had any experiences, let me know. And that's it for today. Please, if you like this video, make sure to subscribe and hit the like button, and I will talk to you again another day. Goodbye for now.